Hi guys, doing a quick video for you on drugs to stop or withhold in renal impairment. So I'm going to be covering very common examples of drugs we stop or withhold in renal impairment. So renal impairment can be caused by medication your patient is taking. It can be caused by renal disease. So some patients have already existing renal disease. It can be caused by dehydration, for example. So if a patient is dehydrated, they could suffer from renal impairment. It can also be caused by acute kidney injury. All right, so we're going to look at very common examples of drugs that we should stop or withhold temporarily in renal impairment. So this is the updated list. This is the updated list of common drugs. So the mnemonic we use is SADMAN. SADMAN is our mnemonic. So the first S stands for sulfonylureas. Sulfonylureas or SGLT2 inhibitors. SGLT2 inhibitors. So which are your dapagliflozin, empagliflozin, and so on and so forth. So the first one is sulfonylureas or SGLT2 inhibitors. These drugs should be considered withholding them or stopping them in renal impairment. The next one, A, stands for ACE inhibitors or ARBs. So ACE inhibitors or ARBs are the second group of drugs that we should consider stopping or withholding in renal impairment. So these drugs can potentially affect the kidneys negatively. So consider withholding or stopping these drugs. The next one, D, is diuretics. D stands for diuretics. So with your diuretics, you want to stop drugs like thiazides, drugs like loop diuretics, because they can have a negative impact on the kidneys. All right, so diuretics is your third group of drugs. The next one, M, stands for metformin. Metformin is used to manage diabetes, and metformin can affect the kidneys, especially if the patient's creatinine clearance is less than 30 ml per minute. So the minimum creatinine clearance for metformin is 30 ml per minute. So if a patient has creatinine clearance less than 30 ml per minute, we should normally stop metformin. The next A stands for antibiotics. Antibiotics. So not all antibiotics, some antibiotics normally or can affect the kidneys. So we should consider stopping or withholding those antibiotics. So a very good example would be aminoglycosides. Yes, so your gentamicin, for example, neomycin, for example, aminoglycosides can affect kidney function. We also have vancomycin. Vancomycin is also nephrotoxic. So consider withholding drugs like that when a patient has renal impairment. The last one here is NSAIDs. The last one is NSAIDs. NSAIDs are popularly known to affect kidney function. So consider drugs like naproxen, diclofenac, nefopam, ibuprofen. Those drugs can also potentially affect a patient's kidney function. All right, so SADMAN is your mnemonic, and this is the updated list that contains common drugs that can affect kidney function, and so consider stopping or withholding these drugs. Thank you so much for watching this video. I'll see you soon.